Does IVF cause long-term health effects on offspring? Imagine a future where families can choose the best way to have children and know what to expect health-wise. Assisted reproductive technology like in vitro fertilization has helped many realize that dream. But some wonder if it might cause health issues for the children later in life. Let's look at what science says about this question. In vitro fertilization involves fertilizing an egg with sperm outside the body, then placing the embryo into the uterus. This process often includes hormonal treatments to stimulate the ovaries, growing the embryo in a lab, and sometimes freezing and thawing embryos for later use. These steps are different from natural conception and have raised questions about long-term effects. Most children conceived through in vitro fertilization are healthy in early childhood. However, some studies show a small increase in risks for certain health factors as they grow older. For example, some research suggests they might have slightly higher blood pressure, blood sugar levels, or body fat. These factors could raise the chance of developing conditions like diabetes or heart disease later. But it is not clear if these risks are directly caused by the procedure or by other factors like parental health or pregnancy complications. Babies born through in vitro fertilization are more likely to be born early or with low birth weight. These birth issues are linked to health problems later in life. So, some of the long-term risks might be connected to these early birth factors rather than the fertilization process itself. There is also a small increased chance of certain birth defects and rare genetic conditions caused by epigenetic changes, which are modifications that affect how genes work without changing the DNA sequence. These changes might influence development and health, but overall the risks are low. Often, these issues are more related to the underlying infertility of the parents than to the in vitro fertilization process. Some studies have looked at the risk of cancer in children conceived through in vitro fertilization. The results are mixed, with some suggesting a slight increase in certain cancers like leukemia, but others find no difference. These findings could be influenced by other factors, including parental health and genetics. When it comes to brain development and mental health, research shows no major differences between children conceived naturally and those conceived through in vitro fertilization. Some conditions like obsessive-compulsive disorder may be a little more common, but overall, cognitive and behavioral development appears similar. Animal studies suggest that in vitro fertilization might have effects that could influence future generations, but we need more research to understand if this applies to humans. For families thinking about using in vitro fertilization, it's helpful to know these facts. While some risks exist, most children conceived this way grow up healthy. Regular health checkups and monitoring can catch any issues early. Advances in fertility treatments continue to improve safety and outcomes. Remember, many factors influence long-term health, including parental health, pregnancy conditions, and genetics. Knowing this helps families make informed choices and plan for a healthy future.